You've been blaming yourself for months, maybe years, thinking you're the reason you're not getting pregnant. But the truth is, and not many people talk about it, that we have male factor infertility that is involved in obviously 50% of all infertility cases. And so many women are carrying guilt that isn't theirs to carry. I hear this constantly from women in my fertility circle. They've been tracking their cycles, taking supplements, fixing their diet, doing everything right, while their partner hasn't been even tested at all. And when I suggest getting their partner's sperm checked, the response is sometimes, but he's had children before, so it can't be him. Well, that assumption is costing you time, money and emotional energy, because unfortunately it's just not true. Male fertility also declines with age, with semen volume, sperm count and sperm motility all decreasing over time. And just because your partner fathered a child 5, 10 or 15 years ago doesn't mean his sperm quality is the same now. Fertility isn't static for men. It changes based on age, lifestyle, stress, diet, toxins. All the stuff that's affecting you is also affecting him. A significant proportion of men with infertility have increased DNA fragmentation despite having normal semen analysis results. And that means a standard semen analysis that checks sperm count, motility and morphology can come back totally normal, but the DNA inside those sperm is damaged and fragmented, which directly impacts fertilization, the quality of the embryo, implantation and also the risk of miscarriage later on. I have a client who went through 7 IVF cycles, 7, before anyone actually thought to test DNA fragmentation, and turns out was him. Yes, not her. And now they're addressing it with antioxidants, lifestyle changes and reducing oxidative stress. 7 cycles and thousands of dollars could have been avoided if they would have tested that from the start. DNA fragmentation testing is not part of a standard sperm test. It's an additional test that measures how much of the DNA inside the sperm is broken or damaged. So get a full semen analysis that includes volume count, motility, morphology and also DNA fragmentation. And don't stop there. Get also the hormones tested. Testosterone, LH, FSH, prolactin and estradiol. They all play a role. Male factor is real. It's common. It's also fixable if you know that there is something to fix. So stop carrying the burden alone and get your partner tested properly.